Now turning to the Target 12 investigators, they're continuing their in-depth reporting on Rhode Island's troubled vaccine rollout. Today we're joined by 12 News Politics Editor Ted Nesi, who's been part of the Target 12 team that's been tracking all of these developments.
So Ted, before we talk about the vaccines themselves, let's also talk about the big news this afternoon, the discovery of those first cases of that so-called UK variant here in Rhode Island now. You've reported not unexpected here, though.
Right, Brian. Yeah, experts had been telling us for weeks it was inevitable this UK variant would eventually be found here in Rhode Island. But I do think it shows how this pandemic keeps evolving and the information keeps evolving. The reason this variant has gotten so much attention is that it does appear to be significantly more contagious than other strains and potentially more deadly. The head of Brown School of Public Health, Dr. Ashish Shah, was saying yesterday he thinks only about 5% of cases nationwide right now are the UK variant. By the middle to the end of next month, he thinks it will be the majority of cases. So that's how fast it's expected to take off in the population nationwide. And that's one of the big reasons why there's so much pressure to quickly vaccinate as many high-risk people as possible.
And Ted, the news about that new variant being in Rhode Island is only adding to the frustration we've been hearing about the vaccine rollout.
Yeah, Kim, initially Rhode Island was vaccinating fairly quickly when you looked at the national statistics, but just has not really ramped up. In fact, we have a chart from our WPRI.com COVID tracking page here, and this shows the number of doses given each week. First dose is in blue, second dose is in yellow. And as you can see, the number of shots given out has actually gone down in the last 2 weeks. And at this point, Rhode Island ranks dead last for vaccinations overall. Now, Raimondo administration officials I spoke to today tell me they think things will start to speed up on Thursday when those new mass vaccination sites open. But right now, the CDC says it's delivered about 80,000 more vaccine doses to Rhode Island than have been administered. And coming up at 5 and 6, Tim White has an investigation and some information about the status of all those unused shots.
Ted, likely that, of course, is raising more questions about how much the vaccine rollout is being affected now by Governor Raimondo's looming departure.
Yeah, Brian, I think it's a huge reason more people are losing patience about that situation. Earlier today, Cranston Mayor Ken Hopkins told our colleague Brandon Truitt he thinks it's time Raimondo steps down and let Dan McKee formally take over as governor. He says most of the other Rhode Island mayors agree. Sources tell me there's also considerable tension at this point behind the scenes between the Raimondo and McKee teams. Both sides currently tell me they expect her to be confirmed and step down next week, but that's not official yet with no Senate vote scheduled.
All right, thanks for that update, Ted. And as Ted said, Tim White will be here coming up starting at 5 with new information about the status of Rhode Island's doses.